Good afternoon, and welcome to the Board of Health meeting of September 12th, 2022. Please note this meeting is being recorded and will be available shortly hereafter for scheduled and on-demand viewing on any smartphone or tablet device. If anyone else is recording this meeting, please notify the chairman. Pursuant to Governor Baker's July 16th, 2022, signing of an act relative to extending certain COVID-19 measures adopted during the state of emergency, including the extension of the March 12th, 2020 and July 15th, 2022 orders suspending certain provisions of the Open Meeting Law, General Law, Chapter 30A, Section 20, until March 31st, 2023, this meeting of the Chatham Board of Health is being conducted in person and via remote participation. Every effort will be made to ensure that the public can adequately access the proceedings as provided for in the order. A reminder that persons who would like to listen to this meeting while in progress may do so by calling the phone number 508-945-4410. Conference ID 833-301-898#, or join the meeting online via Microsoft Teams through the link in the posted agenda. While this is a live broadcast and simulcast on Channel 18, despite our best efforts, we may not be able to provide for real-time access. We will post a record of this meeting on the town's website as soon as possible. Now I'd like to turn the meeting over to Dr. Hanson, our chairman. Thank you.
It shall be the policy of this board to conduct its meetings under the open meetings law. Sorry. It shall be the policy of this board to conduct its meetings under the open meetings law so as to encourage public participation whenever time permits and as part of agenda item discussions. We have 6 items on the agenda today. We do have a deadline of 5 o'clock today because of another meeting starting in this room, so we'll have to tailor our discussion to that time frame. And first, we can make sure we have a quorum. We have 5 board members and 1 alternate. I'll call your name and say if you're present. Ed? Ed. Present. Ron? Broman. John Beckley?
Here.
Carol?
Here.
And I'm here, so that's a quorum. And we have 1 alternate, Dick Edwards. Okay, so first on the agenda is a variance for Sandra Dalby, 303 Forest Beach Road, Clark Engineering. I see Mr. Clark is here, and he's heading to the microphone.
Good afternoon, David Clark, on behalf of the Dalbys. We started this project quite a few years ago now. When the Dalbys bought the property, we were hired through their builder and architect. We had stated at the time that we suggested that they upgrade the septic system as part of the demo rebuild of the house. And apparently the Dalbys never got that message through their builder. The response we got was there was no money in the budget for it. I cautioned them again, saying the house was owned by a widower that was by herself for a number of years, and just because it passed the Title V inspection didn't mean it was going to last, and it didn't. Lasted about 2 years, I think, maybe 3. So here we are. We have a upgrade of the failed leaching pit. The tank was upgraded at the time the house was rebuilt because the old tank was in the way of the rebuild. We've got the system as far away from all the wetland resource areas as we could possibly get it. Even if we did the system 3 years ago when the house was redone, it would have been in the same location. We're going to conservation, I think, on Wednesday on this. Again, we've got it as far away from the top of the coastal bank, which is 60 feet, where you require 100 feet. It requires no Title V variances. It's strictly a local upgrade. Be happy to answer any questions.
We have plans for a house, but the house plans you submitted, that house was built several years ago.
Yes.
And so it exists now, yeah?
Yeah.
And then there was a previous Title V system?
It was.
Yeah.
It was a 78 code system.
Okay. And no change in bedrooms, so I'll
Nothing's
open
changed, yeah.
questions from the board or discussion?
And one question, the vent is right on the property line. Is there any restriction? You can have it right on the edge of the next door neighbor's property, a fan and a vent from the leaching
No
field.
matter where we put it, we're gonna be in somebody's backyard. The houses are real close there.
Yours and me.
The houses are real close. The other neighbor to the west of us, their house is less than 3 feet from the property line. So, and I'd rather not send it down towards the coastal bank. I mean, we can put a charcoal filter on it. That would be the neighborly thing to do. Yeah.
Okay, other comments? Ron?
My one? Yes, where it goes onto the stone driveway, does it have to have an extra strong tank there where the driveway goes on it?
Yeah, it's gonna be, I think it's specified on the plan, H20 loading, so that's for heavy truck.
Okay,
So it is, that's been provided for.
thank you.
Okay, so it looks like the new leaching area is as far away as it can be from the coastal bank. So anyone like to make a motion?
I'll make a motion, we approve the request, the variance request.
And is there a second? Ron seconds. All right, we have a motion? Yes, read the conditions, please.
The applicant shall restrict this property to a maximum of 3 bedrooms and record this restriction on the deed at the Barnstable County Registry of Deeds. The applicant shall submit a copy of the executed deed restriction to the board. The engineer shall submit an engineered as-built plan, including as-built elevations with a written certification that the system has been installed in accordance with the approved plan, and no alteration to the floor plan of the dwelling will be allowed without further review by the Board of Health or its agent.
Okay, and any input from the public on this variance? Hearing none, we can take a vote to approve the variance. We can probably do it as a voice vote. All those in favor say aye.
Aye.
All those opposed say nay. Okay, hearing none. The variance is approved.
Thank you.
All set. Okay, the next variance is for IA Technology for Michael and Susan Franco, 55 Oxbow Drive, TS Land Surveying, and is Chris Childs, someone here to
Chris
present the
Childs,
case? Chris Childs, he's on the
Chris Childs
call.
from Pager Builders here.
Okay, go ahead.
Yes, Chris Childs from Pager Builders on behalf of the property owners. So we are proposing to add a master bedroom addition to the house. It's currently a 2-bedroom house on a 14,831 square foot lot. So we're proposing to add a 3rd bedroom and to use an IA Technology septic system. And I'd be happy to answer any questions.
Yeah, so currently a 2-bedroom dwelling, and they're going for 3 bedrooms.
That's correct.
And then, Judy, on our information sheet, it has it says 3 and 4, and then in parentheses 2 and 3, but it's a current 2-bedroom, 1 extra bedroom going to 3 with IA Technology.
Yes,
Correct. I made a mistake on the application.
yeah, there was a mistake on the floor plan. There's only 2 bedrooms on this, or there's only 1 bedroom on the second floor?
1,
Correct.
yeah.
There's only
Right.
1 bedroom on the second floor.
Right, so they're going to 3 bedrooms, not 4. 2 to 3.
Questions from board members?
Question for Judy. Why in a recommendation does it say in number 2, this covenant and 5-bedroom deed?
Oh, that's a mistake. That's a typo.
What should it say, 3?
It should say 3, yes. Thank you. These are
Yes.
kind of boilerplate.
I do have a question too. It looks like it has the potential to be a 5-bedroom house. if a second bedroom could be put on the upstairs.
Well,
And
the addition we're building is it's gonna have a vaulted ceiling or cathedral ceiling, so there will be no attic space to use.
I'm talking about the
And the
existing.
existing house, existing dining area, kitchen, those are also cathedral ceilings, so the only space available on the second floor is the existing bedroom that's there, and a bathroom.
What about the unfinished attic area?
That's a low space, it's under a sloping roof, it's a Cape Cod style house, so the front of that, the space in that area is a very low sloping ceiling in there, and there's really no space for an actual bedroom, for any habitable space for that matter.
Yeah, so I think if it's an unfinished space, we can't consider it as a bedroom. I mean, obviously, well,
No, I'm just saying potential.
right, but
Right. But it's unfinished, so we don't
at the
look
moment.
at it.
Okay, so it's adding one extra bedroom with the installation of an IA system. And can I get a motion to approve?
I will approve, I will move that it be approved.
And a second? Can I get a second on the motion? Second. Ed, second it. Okay, and Judy can read the conditions for us, please?
So the applicant shall restrict this property to a maximum of 3 bedrooms and record the restriction on the deed at the Barnstable County Registry of Deeds. The applicant shall submit a copy of the executed deed restriction to the Health Division. The applicant shall sign a covenant with the board agreeing to comply at such time as the town of Chatham, through its Board of Health and/or Board of Water and Sewer Commissioners, directs the connection of this property to the municipal sewer when it becomes available. This covenant and 3-bedroom deed restriction shall be recorded at the Barnstable County Registry of Deeds, and a copy shall be submitted to the Board of Health. Throughout its life, the system shall be under an operation and maintenance agreement. The operation and maintenance agreement shall be for at least 1 year and may be with any Mass certified operator of the appropriate grade that has received training by the company on the operation of this system. Effluent from the system shall be monitored at least twice per year for the first 2 years, preferably May and October. The effluent shall be field tested in accordance with Mass DEP standard conditions for secondary treatment units certified for general use, revised March 20th, 2015. In addition, a lab test of the effluent for total nitrogen to meet the performance standards of 19 milligrams per liter shall be analyzed by a certified lab. Water meter readings are to be provided with the semi-annual reports. If any of the field tests or lab tests fail, follow-up tests shall be conducted by a certified lab and an evaluation made by the operator within 30 days. After the required 2 years, testing application can be made to the board or their agent for review and possible modification of the monitoring requirements. The applicant agrees to apply a minimum of 6 inches of compacted topsoil to all disturbed areas of the property. The engineer shall submit an engineered as-built plan, including as-built elevations with a written certification that the system has been installed in accordance with the approved plan. No alteration of the floor plan of the dwelling or the engineered site plan will be allowed without further review by the Board of Health or its agent. And this variance is granted pursuant to the Town of Chatham subsurface sewage regulations and is valid from 1 year from the date of the Board of Health approval. A permit must be issued and work commenced during that 1-year period, or the variance shall expire.
Okay, thank you. Any input from the public on this variance? Hearing none, we have a motion, so we can go ahead and take a voice vote. All those in favor of the variance to 55 Oxbow Drive, say yes.
Aye.
Aye. All those opposed, say aye.
No, I was no.
You vote no?
No, I was late coming.
She's an aye.
You're an aye. Okay. So it's unanimous, it passes, you have your variance.
Thank you very much.
Chris, I'll be sending a letter with all those conditions laid out.
Okay, thank you.
You're welcome.
Okay, next on the agenda is discussion, review of the proposed rental bylaw, and this is a continuation of the discussion we've had the last couple of meetings. Judy has sent out to us a preliminary draft proposal that is somewhat modeled off the one from Orleans. And the idea is to have a draft proposed that then we forwarded to the Select Board and a number of other committees to get the discussion going about this rental bylaw, in hopes that it would be on the town meeting for May. So Judy asked for some questions, some comments on the rental bylaw draft, and so I'll open it up for discussion. Rick?
A couple things. We're talking about 2 occupants per bedroom plus 2. But my question is, what is the definition of an occupant, particularly with regard to children?
So
So
that
if a
would,
child, if you have a 14-year-old who's going to use as much water and create as much sewage as an adult, or a 3-year-old that might be still in diapers, do we have to have something in this that defines an occupant as an individual over the age of
that-
5 or 3?
so that would be a discussion that we could have. There are some towns who say no children, but I agree that, you know, if you say no children, what's the definition of children? I think
Right.
keeping it at 2 people per bedroom, I mean,
I mean, a 16-year-old uses more water than a,
right. So that would be,
50-year-old.
that would definitely be a discussion when we formalize the details of this that we could have. Personally, I think we just leave it the way it is,
Yeah,
but,
it's a fair point, Dick. You're making a fair point, that a 6-month-old infant,
right.
you could make a case, does not count towards that occupancy limit. But anybody, you know, older than, but it's still going to be arbitrary. You're still going to be, you know,
What's the definition of an individual? It's,
Right.
you know.
I mean,
And then the other
I think
point,
the housing code defines anybody over a year old as a person.
I was going to ask, when it comes to the occupancy
Yeah,
in other codes, are there
and
precedents?
I can double check that, but I'm
Yeah, well,
pretty
that-
sure that's what it is.
then that makes it very restrictive. If a family wants to come and rent a cottage and they have a 2-year-old, then that counts as against
Against one.
one of their people, which would seem to be harsh. The other issue related to parking, we say all parking must be on the premises. Does that mean so can you have 8 cars parked on the front lawn in this situation? If somebody has a 3-bedroom house and is renting it to 8 guys from a fraternity, and they each come in their own car, is it okay to park 8 cars on the front lawn of a?
That would be up to the
3-bedroom?
homeowner to decide, I think, and
Do we have any rules in town about parking on the lawn?
Probably not. I would suggest that that kind of an issue, one of the reasons why we're gonna be sending this out to other boards and departments is to get their input. And I think, quite honestly, the issue of parking is more germane to, say, the Community Development Department as opposed to the Board of Health. So I'm not saying you don't wanna talk about it, but I'm just saying I wouldn't, for you guys, I wouldn't get too wrapped up over that. Let's send it out to others, get their input. Because I know this topic of parking and whether there has to be assigned space, assigned spaces for each car versus parking on the lawn has been talked about before in the past.
It has been.
So it's probably more appropriate to have them weigh in on that particular topic, than you guys spend too much time worried about it.
Bob, does on-site parking mean no curb parking? Can you does parking on the road in front of the house, is that considered
That
on the
would
property?
not be
or-
considered on-site parking. On-site parking would be
Not.
considered within the property lines.
Right, so.
So if there is parking available on the street, which is in the public vein, if you will, there'd be 2 different parking areas, basically.
So a renter could park cars along the street, as anyone else
Yes.
can, I guess?
Yes, they would have as much right as anybody to park in the public
Right.
area,
Yeah.
if you will.
Okay, and I just go back,
Sorry, so you can park overnight on the street in a residential zone?
I believe so. You can't park like motorhomes and things like that overnight, but I believe you could park a car, but we could double check that. And again, that's feedback we'd expect, say, from the police department.
Right, unless we want to get into the nuisance discussion.
Now, but
Yeah.
there are roads where if you park in front of a house, I'm thinking of River Bay, you're taking half of that right-hand lane.
Yeah,
I mean, there's not really a shoulder there. I mean, you're parking in the driving lane, in that scenario. I've always felt that we're not supposed to park in the street at night, but maybe that's just a perception I've had
Yeah.
because of the tightness of the streets.
we can certainly check on that and
Yeah,
verify with the police department.
Well, we
Yeah.
say on the registered premises, and I would interpret that as meaning it's on the property.
Got to be in the driveway.
Not sitting out in the street in
Yeah.
front of the property.
Right.
If you want to sit on the street with all four wheels on the lawn, then I guess you're on the premises, and then we get into that other issue.
right.
We need,
But what Bob is saying is, parking on the street is a right everyone has, so that would be separate from the rental agreement issue. But I have always assumed unless the street says no parking, you can park there. That's why they put up all those signs.
right.
I had one, going back to what Dick said about the measurement of occupancy. Towns have different measures. I would say, just for context, most of the towns, for the rental properties, use 2 times the number of bedrooms, which
Plus
is
two.
fairly restrictive. Orleans did 2 times the number of bedrooms plus 2 bedrooms, which is a
No,
little.
no, plus
more-
2 people.
Plus 2 people. So I think that's kind of an open discussion about where that's going to be, whether you want to be more restrictive or less restrictive for a rental property. This is not a, private home. The other question I had is, you can rent 1 bedroom in a home. If you have a 3-bedroom home, you can rent just 1 bedroom. So if you rent 1 bedroom, you'd get 2 times the bedroom, and then plus 2, so you could have 4 in that bedroom under the 2 times the number of bedrooms plus 2. If you rented 1 bedroom, you could have 4 people in there?
Well, you could have, the question is, can you have more people in the house? If you have 2 bedrooms and you allow 6 people, 2
Somebody
of those
sleeping
people
on the
can
couch.
sleep on a pullout in the living room
Right.
Right. But I'm talking
before
about
you're
is,
in violation.
I think, and I don't know for sure, that people are renting through the internet type thing. They will rent by bedroom, individually, by the night. So if you decide to rent just 1 bedroom in your home, then you could rent that. If it's 2 bedrooms plus 2 people, I'm guessing you could have 4 people in that room.
That would not be the intent of this.
I would
mean,
suggest no.
we would need to
I would
wordsmith
suggest
that.
if you're only renting 1 room in a house, okay, you could only, if that room is approved for 2 people, you could have 2 people.
So there could be some language that
Would have to qualify.
adjusted by the
Yeah.
number of bedrooms, right?
Yeah, if
Okay.
you're renting the whole house,
Right.
that is when your 2 people per bedroom plus 2 kicks in.
Yeah.
But if you're only renting out a room, then the occupancy of that room would
Is-
cover it. That's the way I would look at it.
I would agree with
Yes.
that.
Yeah,
But that might have to be clarified in language.
yes. Yes.
Okay, other comments from the board?
Well, there is a lot of comments in
Yeah.
here where it says registered with the Board of Health, followed by the board. And then there was the question about whether we really wanted it to be Board of Health. Can we just say you need to apply to the town of Chatham?
I was
Without
gonna suggest
specifying?
for now, we would
Designated.
just put town, and then ultimately, as the discussions go forward, decide what department is gonna be the lead here.
You mean
Yeah,
everywhere where it says Board of Health, you would just put town?
Yeah,
I know in most towns, the Board of Health winds up being the entity that looks after this.
right.
But I'm guessing it goes through the Select Board and then it's designated to the Board of Health.
I thought when I read the comments relating to Orleans, that there were no other towns on Cape Cod that had rental bylaws in effect. Am I wrong on that?
Yes,
Short-term rental.
short-term rental.
Yeah.
Yeah, no, I looked and.
Short-term rental, anything less than 30 days?
31.
31 days.
But I believe
Specifically,
that,
yes, for short-term.
So there's no other model that's out there and working.
no, let me answer. I think, I looked through it, and somebody can correct me if I'm wrong, but I think that, I read that Falmouth has one, I think Barnstable has one, Harwich has one, Eastham has one, Orleans has put one in place. It's, not fully implemented. Provincetown has one, Tisbury has one. So it's more correct to say most of the towns on Cape Cod have a rental bylaw. It's the common thing, to me. Now, Bob may know more about it, or Judy.
No, I think that's right, and I think it just all gets into short-term versus a rental bylaw.
Right.
A rental bylaw could be year-round rentals versus a short-term rental bylaw.
But I think these are all short-term rental bylaws that these towns have, I think.
I'd have to double
I'd have
check.
to-
but
I'd have
I
to
don't
check
think
because
so.
There are
Yeah.
some
That
out
could
there.
be, the date, the timing of it might make a difference there.
I believe Harwich has a short-term registration that you have to do.
Right.
That's just a single form.
Yeah.
Right, it's just
That's
a
not
form.
a real regulatory scheme.
Right.
Right,
That's just a piece of paper that says, I declare that I rent.
yeah.
That's not
But
where
like
this is
Dennis
going.
and Barnstable, they have rental bylaws, so it's all rentals.
Rent.
This would not be all, year-round rentals or anything more than 30 days.
Under this draft, if I had a 5-bedroom home, could I rent to 10 people, 2 people in each of my 5 bedrooms? 1 night, 2 nights, 3 nights,
Yes.
people coming, people going, under
Yes.
this draft?
Yeah, 2 people per bedroom, plus 2, or whatever we decided on, or whatever the town comes up with.
I think that's a question you brought up before. If you're renting bedrooms individually, at what point does it become a boarding facility?
Oh, you're,
Or a housing, or a rooming
Oh,
board?
okay.
And I think there's a bedroom number. I think if you're renting more than, it's 3 or 4 bedrooms
Yeah.
individually, then it kicks into a
Right,
different entity.
I'd like to have a clear sense of where this would exist in space compared to a hotel, a boarding home.
all of those have separate
Definitions.
state regulations and rules that go with them. So if I misunderstood what you were asking. If you have a house and you're renting out to individual people who aren't related, individual rooms, that's a boarding house. And you have to meet,
That,
State
they are
reg-
then regulated by the state of Massachusetts and
right,
need
and
to be
we
licensed.
would license them as a boarding house.
Okay.
But I also believe that there's probably a rule they can't be in a residential neighborhood. I'm guessing.
There are rules for that. I would have to
Zoning
check what
rules.
zoning
Yeah.
rules are. Same
So-
thing with bed and breakfasts, that's something different.
Now, Judy sent out, I believe, a thing from the state website that defines a lodging house or establishment, and it says, a lodging house or establishment is where lodgings are rented to 4 or more persons unrelated to the operator.
Right.
So that would be, if you're individual bedrooms, you could rent 4 individual bedrooms, but if it's more than 4, becomes a lodging house, and then there's a different category. So that's fairly
Right.
broad.
Yeah, I mean, keep in mind, this whole thing with the short-term rental bylaws is relatively new. Everybody's trying to respond to things like Airbnb and all that stuff. State regulations will always be behind. It takes the state forever to change some regulations. So, this whole idea of defining a bed and breakfast versus an Airbnb versus a boarding house, let's just do what we want to do and not get too caught up in
Okay.
what some of these other things may be. Because it may be a decade or more before everything else potentially catches up. And there's.
But I also think that this is, along with that, this is kind of a preliminary draft, going to a bunch of committees, lots of input, town council, this and that. All these things will be worked out, and they'll, have the specific language, I think,
Right.
as it goes along. So I don't, like Bob said, I don't think we get too hung up on all the little specifics, but we get this thing going, get the conversation going, because that's going to take time to get to the end point. But the other comment that was brought up is who does this, Board of Health? Now, we have a Department of, let me just, of Economic Development, which we have people in the town that are now involved with community development and housing. And in fact, there's a new hire, and Katie Donovan, can you just explain her position and the new hire and how that works into this whole process?
Yeah, Katie is the Director of Community Development, and they've just hired Gloria McPherson is her name, and she's the Housing and Sustainability person.
Housing and Sustainability
Coordinator, yes. And her and we discussed this today, and she's quite knowledgeable on these types of regulations or bylaws. So it would definitely be helpful to get her input and their input, and she's more than welcome to come and talk to the board at any point. And then there is an Economic Development Committee who would be another group that I think would definitely.
Is Katie Donovan the,
She's the staff liaison, I
Liaison,
believe,
yeah.
for them, and we would want input from them. I mean, in order for this to get moved through, it has to get, we'll have to go to the select board, who are then gonna want all the input from the other committees, which is what happened the last time.
yeah.
This time, we want to keep the ball rolling, so.
Right, I'd go back to the 2017, when it came before the Select Board. The Select Board didn't turn it down. They referred it back to the Economic Development Committee, the Finance Committee, Water and Sewer Committee, for public input and comment, and then back to the Select Board, and that process just never happened. So part of my idea would be just to push this thing out and get that process back on the track it was on before, send it to the same committees, but add Katie Donovan and this,
Yeah,
and then, so
Gloria.
our rental bylaw draft and some kind of some language explaining what our interest is and what we hope would go to all these people, and then we could continue our own discussion and ask people to come at subsequent meetings and learn more about it as well.
Yeah, I would think that we would want to emphasize that our primary reason for interest in this is to limit the overcapacity, the use, limit the ability of people to rent a 4-bedroom house to 18 people.
An occupancy limit.
Right, that we're having a problem with that is likely impacting our water and sewage problems, and therefore the Board of Health really has an interest in doing this.
Yeah, and I think this is just my impression, could be wrong, when it was before the Select Board, there was just a hint of some concern about an occupancy limit. They were concerned mainly about water. 5 years has passed. Now, our interest, I think, is an occupancy limit. That's just how much things has changed. So it'll be for both things, to me.
We have no idea how many visitors are in Chatham in August of this year, other than driving up and down Queen Anne Road and Route 28.
But
and seeing-
there are estimates of total population in the summer.
No, but we don't know how many visitors are staying in these houses.
No.
And other than to note that there are far more cars on the road this year than there have ever been before. And we're running out of water. All of these people are using water.
Well,
And also, we're using.
I mean, this is where it gets complicated, let's say. Because I was at the Water and Sewer Advisory Committee meeting this morning. And actually, our water use this August compared to last August is down significantly. And also in the first part of September. Now, you can attribute that to a couple of things, as was rightly pointed out at the meeting. It could be all our conservation wording and messaging to the public, and so, people are conserving water. But it was also pointed out that frankly, there aren't as many COVID-related people here in town Last year, everybody was fleeing the cities, they all came to the Cape, they all stayed longer and whatnot. We're not seeing that as much this year. People are going back to work, they're going back to school. So, it's hard to say that the decrease in water use is due to any one thing, but that's what makes it so complicated. When we did this in 2017, the driving force behind that effort was water use. We had a selectman at the time who was convinced that, these short-term rentals were the death of Chatham because they were using up all our water. Now, it's changed a little bit that your main concern is the occupancy, which I think is an absolute legitimate argument that there shouldn't be any more people in that building than the septic system was designed for. And I think from my perspective, that's a cleaner and neater argument than, say, water usage.
But it captures water use.
captures
It
water-
captures septic overload, it captures neighborhood
It captures
disruption,
parking, it captures water
everything.
use,
Yes.
but in terms of Board of Health jurisdiction, your primary jurisdiction is number of people per bedroom.
Right.
Because that's what your rules, that's what you're trying to make sure is complied with. It gets into fire, it gets into parking, it gets into all those other things
Yes.
that have been talked about within the public realm. That's why we want to get input from everybody else to make sure that this is going to address all those other issues, at least peripherally, even though they may not be the be-all and end-all for it, but they're definitely part of the discussion.
Yeah, and don't forget, this came from us looking at numbers of bedrooms in houses and these newer houses with all the amorphous rooms. We've used number of bedrooms to judge how much usage of the septic system there's going to be. And so this is now just going directly to occupancy, which is, a lot better way to do it, I would think.
And, it's more complicated because, as you know, we have a comprehensive wastewater management plan. We're in the process of sewering the town. So, that was one of the concerns when we first did the comprehensive wastewater management plan. If you sewer, then septic size is no longer an issue. And that's why we passed the regulation that we did that said you can have the same thing on sewer that you can have on septic. So that we didn't get into, I had a 3-bedroom house with a septic system, so I could only have 6 people. Well, that 3-bedroom house is now on a sewer, so I can have a dozen people.
Right.
Well, we said, no, that's not the case. For that very reason, that was an occupancy issue.
I'm reading an article from the Cape Cod Chronicle, August 11th, recently. And in that, Mr. Ford, who's the town attorney in Orleans, is quoted as saying that there was no precedent on the Cape for a town imposing those restrictions, meaning the number of guests allowed in a rental. Now, so I'm just sharing with you what and again, I don't know. I also see here quoted is, Ford said other communities such as Barnstable and Nantucket have tried unsuccessfully to pass their own bylaws to govern seasonal rental activity.
I don't think that's accurate.
Yeah, I don't.
Because I do know that in Dennis, their bylaw, again, it's a rental bylaw, and they do limit the occupancy, but it's based on square footage of the dwelling, so,
Okay,
50 square feet
all right.
per person in a sleeping room, 75 square feet total square footage.
Okay.
You could have 20 people in some of these
And
houses.
Harwich has one,
And Harwich has a registration, I believe, that it does say 2 people per bedroom.
but they give you an occupancy limit.
Right, there are
I
occupancy
saw that
limits.
quote too.
Okay,
I think-
so
But it's a registration in Harwich, I don't believe there's any,
There isn't.
infrastructure around
It's
it.
just registration.
Yeah.
okay, thank
And I
you.
think Provincetown has one too.
I'm guessing that Katie Donovan and would have a lot more direct information about what you asked about, John. Might have her come here if she would.
If you'd like, we will invite Katie to the next meeting and also the new Housing and
Gloria.
Sustainability Coordinator.
Think that'd be a good
That way
idea.
maybe you'll get some input before we send this out to the world for comment.
Right.
You know, you may
I
hear
think
some,
that's a good
some
idea.
good things at the next
So do
meeting.
We
we,
do have a meeting next week, so that's not far away. We could get that done.
after we are ready to forward this to the select board,
And all the other committees.
do we believe that if they are comfortable moving forward, they will then form an ad hoc group to hammer out the details, including us?
I'm guessing that's unknown. I wouldn't know that, who
You
would,
could,
would actually submit this to the
What you
town
could
meeting?
do is,
Board of Health, Select
you can
Board.
get this to the point where you're comfortable with it, and then you could forward it to the Board of Selectmen with a recommendation that it be distributed to this laundry list of other people and committees and whatnot, and at the Board of Selectmen form an ad hoc committee to shepherd this thing through and get it ready for
Prime
town
time.
meeting.
Okay.
I would suggest you make that recommendation. Don't expect them to,
Necessarily.
I'm on camera, how do I say this politically correct? Don't expect them to do it for you. If you feel strongly that that's the way
Right.
you think this thing should go, you need to make that recommendation to the board.
Right, but I think what would help us is some direction back from the select board as to how they would like, if they sort of generally agree with this kind of a thing, how they want to proceed. Them, us, a working committee, whatever.
I would suggest if you guys want to have this broad-based and you want to have an ad hoc committee formed of other representatives from town departments, committees, whatever, make that recommendation to
We
the
make
board.
it.
You guys make that
Yeah,
recommendation.
the ad hoc committee.
Because, and I think you could do that very easily. I think you just say to them, look, we're looking at this from the septic system perspective and two people per bedroom. We recognize there are other issues, parking, noise, water
Purely
use.
residential neighborhood
Therefore, our
issues.
recommendation is you create an ad hoc committee of, whoever, to look at this, update it, work together and come up with something that could be ready for town
Yeah.
meeting.
The ad hoc committee from 2017, there were 2 select board people, 2 board of health people.
Yep.
Bob Duncanson was on it, Judy was on it, and Katie Donovan was on it. That was the ad hoc committee.
Right.
And so,
Yeah.
yeah, that's an easy way to go. Okay, Dick?
If we wanted to find out why water use has gone down, can the water department look at consumption by property? And so, okay, because there's some it should be obvious who's using irrigation systems and who isn't. If you've got a 2-bedroom house that's using 100,000 gallons of water this year and they're not using it next year, then they've shut their irrigation system off. But you can't go back and look at that.
They could, but you wouldn't necessarily know that that huge change in water use was due to an irrigation system. It could have been that, they had their children and 10 grandchildren living with them because of COVID for a year. Right? I mean, that's the uncertainty that comes into this. When you talk about water use, you just know that that property used X amount of water use. You don't necessarily know why. The assumption in some cases is an irrigation system, because you drive by right today and they have the only bright green lawn in the neighborhood, kind of thing. But to go back and say their water use this year or last year was, 20% higher than it is this year, why? There's really no way to, maybe they had, 5 teenagers staying with them because they played in the Cape League, and they were doing 10 loads of laundry a week versus, a couple who only did 1 load of laundry a week.
We need a graduate student interested in doing research.
Let me move ahead to one other issue we can talk about, and then I'm guessing there'll be a public comment, so we'll get to them, and then we can come back and have some more board discussion if we need to after that, I think. But it's the issue of the fee. And this has that unspoken, I think we need an idea of how many people would be needed to do this system, and in discussing it, there might need to be one full-time inspector and one sort of administrator, additional people hired and paid for by the town, and then some addition to the website, because most of these places, I think, are doing it over the
Software.
website. So there's
Yeah, software.
software. So there's those things would work into the fee. And then the rental fee that's charged can pretty much pay for that cost. The recent estimate is maybe 1,000 rentals in the town, and if it's $150, so that's $150,000, which I don't know, but I'm guessing would cover a couple of people. And so the fee here is, we've sort of scratched it out, but it's not gonna be on the low side. Orleans was 175, a lot of towns are 100, but 150 kind of seems like a number that might be needed, but that could all be worked out by people that know more than we do about that sort of thing. And I read somewhere that you have to be careful that you can't charge more on the fee than the cost of the thing is, otherwise it's a tax, and then it gets to be improper.
Right.
So,
But
any
you may-
comments on that, the fees?
You may have to do your best back-of-the-envelope estimate in year one, and then review and adjust for year two.
But
and
I
three.
think if you want to get this going, when it goes to town meeting, there's probably going to have to be money and personnel in that, otherwise you're looking at another year probably kicking around. So
Right.
we would want to have that all done and all put in that first bylaw for this May, which doesn't sound like it would be hard to do.
I think the $150 fee is reasonable.
Yeah, I mean, that was a ballpark figure, like, back of envelope sketching. I did do a search on mass.gov last week. On September 7th, there were 881 registered with the town. That had gone up quite a few. 881 registered at mass.gov. Most of them, they break them up by zip code. They give you street name, they don't give you street number. So you don't know exactly where they are, you just know that, well, on this street, there's so many. So 881, I would guess that's on the low side, there's probably more than that. So,
But I think we could forward the idea that these other people, or maybe the working group would decide what kind of personnel is needed and what kind of funds are needed, and get that all in the initial thing,
Yes.
so that it could pass in May, and then you at least get going, there'd be, a pretty good build-up time.
right.
And then I had a question, so are these places inspected, did they get register, and then do they get an initial inspection, or is it an inspection only with a complaint?
Well, that would be a topic in the bylaw.
Yeah, because
or in the
800,
regulations.
800
What-
or 1,000 inspections is a lot of work.
Yeah, exactly. And we've talked about that in terms of needing more people and whatnot. So the question becomes, do you do an initial inspection, when somebody gets registered in the program? And then, what would trigger a subsequent inspection? A complaint, obviously. And then maybe every 5 years that somebody's in the program?
Right.
You go back and re-inspect. So, I think that's open for conversation, do you, if Mr. and Mrs. Smith are renting out their house during the summer, does it need to be inspected every year?
I don't think so.
So,
What some towns do is they have a, initial inspection upon registration, and then every year, when you fill out your application, your renewal, then you fill out an affidavit that says that your smoke detectors and everything
Okay.
is.
Like a
is-
self-certification.
Self-certification, exactly. So my thought would be that it would be something that we would go out and inspect everybody the first time. And of course, that may take a year or more to get everyone. And then after that, we would only do follow-up inspections upon transfer of property or upon complaints, so.
And then the term reasonable inspections, that's the legal term, I guess. But at some point, the town attorney has to go and look through this
Oh,
whole
yeah.
thing, and
Oh, yeah.
and that gets when you're at the final draft, and they,
well, or even earlier on.
If questions come
As
up
soon as you
about-
guys have something ready that we're sending out to all the boards and committees, and the selectmen, we'll send it to town council to start that review, if you will. But yeah,
Okay,
because
so,
obviously the sooner you hear any legal issues with it, the better.
The better,
Yeah.
right.
You don't want to get to what you think is the
Too far
final
down the
draft
road.
and then have town council say, oh, no, that's not legal, or that's not legal, better you know that early on.
okay, so, just running through real quick, there's an application for registration, that gets posted in the house, you get an occupancy number, and there has to be a phone number and an address and a person identified, no matter what the ownership structure of the place is, that's on the registration, and it's available 24 hours a day, within an hour, I
Locally.
think is what it says. Posting of notices in this specific language about trash removal, occupancy, we talked about parking, the smoke detectors that are part of the town already, rules, I guess. Keeping a register, that had come up, as to whether it was necessary. I just think it's good to have it, if there's complaints and you have to go back as to what happened back
Yep.
here and how many people and who it was, you have the data, so
Yeah.
I would say leave that in there. Inspections, and then at the end, there's language about the select board as a designee and who carries out
Enforcement.
penalties and all that, and I guess that would be determined later, but that relationship and who does it. So I just ask, what I'd say is, let's see if there's public comment, because there may be a fair amount. If there is, then we can come back for more discussion from the board. Does that sound all right? Okay,
We have. a
public,
hand up.
public comment,
Gloria? Gloria, did you have a comment?
Yes, thank you. This general bylaw essentially is borrowed from Orleans, but is excellent. Being able to use this has saved us thousands of dollars and a lot of work. There's so much that is good within it, such as not renting the unit before registering with the Board of Health and the occupancy requirements, and requiring a registration number on any listing or advertisement should be very useful if monitored, and curtail advertising that the rental sleeps 18 when it only has 2 bedrooms. Orleans is bringing their bylaw to a fall special town meeting. We need to watch its progress. Do we know if we have seen their final version, which is going to their town meeting? I had heard they were making some changes. Orleans was considering a community impact fee. Do we know if that went anywhere? Since the town will have expenses related to administering short-term rentals, some type of impact fee might be considered based on the need for new staff to manage the program and enforce the regulations. And this is a possible new revenue source for the town and is in addition to the registration fee, but I believe can only be charged for properties that are professionally managed. A higher registration and renewal fee should be considered, to recover town expense related to the operation of short-term rentals. The impact fee could also include increased demand on our water system, since rentals usually put a higher demand on resources than standard occupancy by property owners. Same for wastewater costs. Rentals can also influence quality of life, since it is a commercialization of our residential district. In a few instances, our version of the bylaw is not as strict as Orleans. The use of the word may instead of shall is an example. One example of this is on page 4 under enforcement, third line up from the end of that paragraph. It reads, quote, "Any failure to comply after the issuance of said fine may be punishable by a subsequent fine of $300. Orleans uses the word shall. And I hope that you will consider that, because owners obviously will understand the requirements. Also, on page 3, parking, in the Chatham version, the following has been added at the end, quote, without the permission of the off-premises owners, end quote. Do we really want to provide that latitude? And in the keeping of the register section, page 4, would we want to also require an address? And then I have a question about cesspools. Can properties with cesspools be rented? This rental bylaw is long overdue, and many thanks to your board, Judy and Dr. Duncanson, for bringing it forward, and thank you for letting me talk with you.
Okay, thank you very much. Other people from the public with input? Okay, so I'd bring it back to the board. Anyone have a follow-up comment or some additional comment? I think what we'll do is take into account what we've said here, bring it back on our agenda for next week, and hopefully we can get something in a form that we can then send out to all the committees and people. Does that sound reasonable? Good, okay.
So you want me to invite Gloria and Katie Donovan?
Yeah, I think we might as well move ahead, because it would be nice to actually get the thing out after the next meeting, because it's going to be preliminary anyway.
Right.
It's not, totally fine-tuned, and then get it out so they can begin their discussions and public input and let it bounce around for a while, and give them plenty of time to get it done by, January or February or something, whatever it is for the,
Generally non-monetary warrant articles are the middle of January. For this one, for like the additional staffing that you anticipate, we would want to work that into the FY '24 budget, which we will be starting probably in about a week.
Oh, geez.
and when's the end point for that? The budget?
The budget usually gets finalized in February, so they can get the warrant printed.
Okay, so then it goes on the warrant, and then, okay.
Yeah. So Judy and I can work together and put some anticipated into the FY '24 budget, that we propose to the town manager. And knowing that this discussion is happening, I think it'll stay until we get, we see how things are going.
Essentially as like a placeholder to preserve the
Yeah.
ability to proceed if and when we decide to, the town to.
Under the assumption that town meeting would pass this.
Yes.
Because exactly what you said earlier, you don't want to have town meeting pass the bylaw, but there's no money or staffing come July 1 to implement, so you have to wait another year. So we'd want to put something in the budget process now, so that all would be in play come July 1st. All right?
So my impression now is that the registration fee should be able to theoretically cover the cost of the program. That would be the hope.
Right.
Objective.
And then the question of whether there are extra town fees collected on short-term rentals, I don't know the answer to that. There's 2.75% Cape Cod and Islands Water Protection Fund, which I think applies to short-term rentals.
Yes, that was
Are there other-
specifically,
does the
that
town
was
collect enough-
specifically for short-term rentals.
Does the town collect an affordable housing fee or other fees on short-term rentals? None. Okay.
Not yet.
Right, so but I would say, just thinking, that's a whole nother level of something to be
Discussion.
discussed. So let's I'd say get the basics through, and then that could kind of be worked out later. Okay. Is that a plan from the other board members?
I think so.
Okay, and so we'll invite a couple of people for next week. We'll continue the discussion even when we forward it on to people to keep things going. Okay, good, so that's 3. And now, 4 is Update discussion, John McGrath, and I might just ask Judy if she would, I think since our last meeting, we had the inspection with the Mass Department of Environmental Protection. Michael Whiteside, I think it was, came and inspected the property, and maybe Judy can just cover, because only 2 of the board members were there, cover what happened, who was there, what the outcome was, and I think Judy sent to you the letter that Mr. Whiteside sent out to Mr. McGrath, and now there's a response back and all that.
What was the date of that meeting, that site meeting?
I believe it was September 19th.
Okay.
Yes, I'm sorry, August 19th. September 19th.
thank you.
My father's birthday, August 19th.
Or it could have been the 17th, it was 2 days after, wasn't it Wednesday, after the Monday meeting?
Okay,
Yeah.
I can double check the exact date, but,
Okay,
so we did meet out there, and Mr. McGrath was there with a couple of young friends of his to help support him and help him understand where we're coming from. There was also John and Noble and myself there. We had several staff members, the building commissioner, the fire commissioner, and the deputy fire chief.
Biggs was there, right?
I'm sorry?
Wasn't Jay Biggs there?
Yes, he's the building commissioner.
Right.
And his building inspector was there as well. And Lucas and myself were there. So basically, Michael Whiteside is a strike force person for DEP. He goes out on complaints of dumping such as this. His overall feeling about this property was that it's an illegal construction debris dump.
Transfer station.
Transfer station is what he called it. He was not terribly happy with it, but he was excellent with John. He tried to explain to him that he could give him time to start the process of cleaning up. John insisted that he could have the whole driveway cleaned out in 30 days, which we all thought was much too short of a time. But we said, great, we'll be back in 30 days. And Mr. Whiteside from DEP said, if I can see improvement, then we'll keep giving you time to keep cleaning this up. That's the way we left it. He did send an email, copied the health department on that, basically reiterating that we're going to be back at the end of September to see what improvements you've made. A little twist in the story is that last week, John did send a email to DEP saying that he has injured himself and is not able to proceed as quickly as he would like. Mr. Whiteside from DEP did speak with his friends who said that he did hurt himself and that they were trying to help him, and they were going to try and continue or start the cleanup, but we did leave it at that we are still going back on the original date to see if there's been any progress made.
By my eye, I have not seen evidence of a startup of a cleanup. Has anyone else?
I haven't noticed anything. I've driven by several times and
I
seen.
drove by, I did not see
No.
any significant change.
No weight slips have been submitted to you?
In fact, there was
Nothing.
some more dumped.
Okay.
Walk down, there was an old freezer or something.
I think that was there, yeah. Yeah.
So I didn't see any change.
So DEP did say they needed proof of where anything removed from there goes with slips of, manifests of wherever they're being done. So-
Receipts.
Receipts, yes. So that was one thing he's looking for. He said if he doesn't see any improvement, then he's going to refer it up the ladder, basically, to his boss, and he will start getting fined as an illegal transfer station. That's
Yeah,
where
so
we're
just-
at.
So just to sort of context, when this person came, we didn't know if he would come, we didn't know if he would just give some information or a little guidance. But he came, and he has declared it an illegal transfer station, so that's in his purview to deal with that, and he's going to deal with it ongoing. So, and even though John McGrath has had an injury or whatnot, he is still going to come back at the end of this month approximately for another inspection, which I think will be the whole people again, two select board members. We can talk next week about who might go from our group, but,
Yeah.
and then, what was else I was going to say? So, yeah, at the end point of what they do, I think I asked him specifically, what do you do? Well, they basically fine him. So a
State.
fine, it goes a lien on the house, the owner
So-
may not necessarily care about that. It might not necessarily get it cleaned up, but that's a
But
discussion
I
for
think
another
they would
time.
formalize at some point an official NOV
Right.
along with a penalty schedule that would start a particular time. And then, as time goes, if action cleanup proceeds, that's good. But if it goes into the future with no efforts or obvious improvements in cleanup, then the fines start kicking in. And apparently, they can go onto a lien for the property. Is that, did I hear you say that? Or, we don't know
That's what I've
that.
heard,
I'm not
but
sure of
as I
that.
understand, a lien gets paid when the property transfers, it's not necessarily taxed immediately. So it may not have an,
Yeah, I wonder about the nature of the state DEP penalty, that's all.
It's the same thing as the lien that we're putting on the property for
Okay.
the cleanup
So it
that we
might
did
not-
in the road layout and the guardrail and all.
So
We put
it'll
a-
build up over time.
We
Yeah,
put a
it-
lien on the property, that doesn't mean it's gonna be paid tomorrow. It may not be paid till the property gets sold, but the lien puts the town basically first in line for anything from the sale of the property.
but the lien might not affect a cleanup either.
Right.
But that's a different discussion. The inspector, Mr. McGrath let the inspector go down on the far side of the house between the house and the lake. He said there was no significant
Is that right?
material down there. It's almost all in front. And then he also said there was no environmentally hazardous material that fell in a separate category. He termed it as demolition material. So that's a big thing for them. But
Inert, yeah.
Mostly scrap metal and demolition
and the fire
material.
department said that they had, in 2020 or something, they had declared it again a fire hazard. And their remedy is fines as well, I think. It's not like they go in and do anything, they fine him. So that's where it is, so, but I think it's pretty clear that from our standpoint, we would let the Mass DEP carry through with their process and see where that goes and where the endpoint is, and then make our decision from there.
Right.
Okay, good. Other comments or comments from the public or the board?
Yeah, I have one. Bob, has all that money that we appropriated and someone was gonna go up there and clean it out, has that all been done?
No.
No.
There's still a lot of stuff up there that hasn't been removed.
Well, the road layout has been cleaned.
Right.
That,
Yeah.
that has been done. The guardrail is up, the no parking signs are up.
Yep. But on the other side.
But the money that was appropriated at town meeting under your, I forget what we called it now, the
Emergency fund.
nuisance abatement bylaw or something, that we-
Right.
or
That
fund that we
ex-
created, that money is still there.
Available to us
That is
if and when
available
we
to
want to
you.
act in any way.
Yeah, either for that property or potentially some other property in
Right.
town that, some
But
action needs to be
we can
taken.
get the rest of that property down there cleaned up.
We don't know how far that amount of money will
Yeah.
carry in an
Yeah.
We,
onsite
we,
cleanup.
I mean,
Don't know.
Yeah, we're gonna have to find out.
theoretically, we could use that money to clean it up. Mr. Whiteside's, and I'm sort of paraphrasing here, he sort of indicated that it might not be that simple, because you have to differentiate between personal stuff and this and that.
Right.
It's a complicated process.
Yeah.
You can't just hire someone to take everything, apparently. But I'd say, in the two-part plan we have here, the roadway is cleared up, the road is safe, the guardrail's up, the no parking signs are down at the end of the lot. Do we know from the police department whether they're going to enforce the no parking yet? We can check with Andy Goddard for the next
Yeah, I
meeting.
think we do need
Yeah,
to check
no,
with the
they-
police department.
Now that the signs are up, they enforce.
Yeah, and he said, Andy Goddard said they have to notify butters or neighbors first, and then they start enforcing.
Yeah.
So, the road is safe, all those big trucks going up to Nickerson's, I mean, that's a big
big
thing.
plus.
That's a big thing, so that's good. Okay, Dick?
I'm a little confused about the difference between fines and a lien on the house. We had talked about putting a lien on the house to cover the cost of cleanup. Now we're talking about fines from the state. And can somebody escape paying a fine issued for breaking a law, having an illegal dump by just saying, oh, put a lien on my house and I'll pay it in 30 years?
Yeah, theoretically.
You can.
Yeah.
The state can't come and enforce those fines.
The only way you could enforce it, and I've had this conversation with town council, is, let's say there was $100,000 in fines outstanding. You could put a lien on the property for $100,000 and recoup it at some point, or you could go to court and make it a criminal matter. You know, the conversations so far have been, we don't think this wants to rise to making it a criminal matter, if you will. But yeah, somebody could get fined a bunch of money and not pay him, and the lien's put on the property, and that's what a lien is for, is to ultimately recoup that money. But you don't know when you may be in a position to recoup it. So it's not something we use every day, but it is a mechanism available, because the only other option would be a criminal proceeding. And sometimes, you know, things just don't rise to the level of a criminal proceeding. And, you know, when you have a criminal proceeding and you go to court, you never know what side they're gonna come down on. You know, if somebody goes to court and, you know, they stand up in front of the judge and make a compelling argument, or whether it's valid or not, they make that compelling argument, or if they ask for a jury trial, you know, you never know whether you're gonna win or lose. So,
Can I ask, so the lien on the property from the state would be actually to pay the fines?
I think they could lien, yes, for outstanding fines, yes.
Okay.
Okay, any comment from the public on the 32 Mill Hill Road property? Okay, I guess we can move on to item 5, update discussion, Chatham water quality. And I guess Bob would give us that update.
Yeah, relatively quick, as you probably, well, not probably, I know you know, the temporary treatment facility for well 5 has been up and running since May. It's been sampled multiple times since then, and all the PFAS levels have come back non-detect, so it is working exactly the way it was anticipated to work. They are working on additional plumbing, if you will, additional piping, to provide the option to connect well number 8 into that treatment facility if, you know, absolutely needed, if we got into a situation where we lost, say, a bunch of other wells in the town forest or something like that, and we needed to bring well 8 on, because wells 5 and 8 were the 2 wells that had the PFAS in it, that they could do that. They could bring well 8 also into that temporary treatment facility, so they're working on that right now. They are about, I would say at this point, they're probably about 70% along in the design for the permanent treatment facility for wells 5 and 8. Remember, what we have in place now is only temporary. It's basically just one granular activated carbon vessel. They are designing a permanent treatment facility. That was already kind of envisioned anyway because of iron and manganese. It's now going to be iron, manganese, and PFAS. And when that facility is built, the temporary vessel will be actually moved into the permanent treatment plant. So they're about 60%, 70% along in those design plans. They're getting ready to file with the Planning Board and the Zoning Board of Appeals for that project. That will be coming up over the next couple of months. I was just asked this morning if it was okay if they moved the ZBA meeting till the beginning of November as opposed to the end of October, because ZBA is way busy right now. They have a lot of things on their plate. So that's kind of the time frame for the permitting, if you will, for that facility. And then it's just a question of getting the design plans completed, getting those to DEP, getting their approval, getting the project out to bid. You know, it'll probably be late 2024, early 2025 before that permanent facility comes online. But hopefully the temporary treatment facility will get us through, obviously got us through this summer, will get us through next summer, and then probably the summer of 2024 as well, before the permanent facility is ready to go. So that's the kind of latest update on 5 and 8. You know, they haven't been using 8 at all, and luckily because of the drop in demand, because of either the conservation measures or less people in town, whatever it happens to be, all the other wells were only pumping, you know, around 12 to 14 hours a day, which is great. You know, at one point, we were up at over 20 hours a day, which, you know, you really never want to do. Well number 4 out here has also been back online, and again, that's only being used for a couple hours a day kind of thing, you know, when conditions really warrant additional water. Wells 10 and 11, the two new wells right down by Mill Pond in the northwest corner of town, they actually started construction about 10 days, 2 weeks ago. The access road is in, they've cleared the area for the new treatment plant, and they are supposed to be pouring concrete for the foundation for that next week. So that is currently underway. That will be, wells 10 and 11, the casings have been in for about a decade or more, but then it was stopped and nothing else was done because of the MTBE contamination. That's no longer an issue, so we're fast tracking getting wells 10 and 11 up and running. The expectation is probably about an 18-month process, so they probably won't be ready for next summer, but they will be ready for the summer of 2024 at this point. So they cleared the access road, they've cleared the site, concrete pouring next week. We've been having conversations between water and sewer because we're putting sewer on Mill Hill Road and we're also upgrading the water main. Right now, Mill Hill Road is only an 8-inch water main, but because of the addition of the 2 additional wells, we're gonna upgrade that water main on Mill Hill from the well site out to Route 137 with a 12-inch main to handle the additional flow that'll be coming from the new well site. So we've been coordinating with the 2 different contractors, one on sewer, one on water, making sure they're all working together and whatnot to get that done the most efficient we can, because we only want to disturb the neighborhood once, and we only want to have to repave the road once. So we're actually looking at potentially hiring either the sewer contractor or RB Hour to do that additional work out on the road so that we don't have to deal with quite as many contractors potentially pointing fingers at each other. So.
Do we anticipate that these new treatment facilities will get Chatham to 0 detectable PFAS that may be the new standard?
I'm a scientist. To my mind, there's no such thing as absolutes. Granular activated carbon gets us down to non-detect. Under current detection abilities, that doesn't say if 5 years from now they come up with some new detection method that gets even lower than parts per trillion, but I mean, we're gonna be going with state of the art to get down to non-detect. That's the goal.
But I think they've proposed 0.02 parts per trillion
Yeah,
as the new goal.
I mean, we
which is
should be
insane.
there.
It just,
yeah, I'm, but like I say, I'm a scientist. There's no such thing as an absolute,
What's happening generally with the water table, up, down, just continuing to go down?
The water table is still going down. If you want, I can give you, I made a presentation to the Water and Sewer Advisory Committee meeting this morning.
It's just steadily, what you would expect, but steadily going down over the summer drought.
Yeah, if you hang, I can quickly show you.
But you're pumping enough to fill the tanks and all that above?
Yes, they are pumping enough, and like I say, with the decrease in water use that's taken place, the wells are not pumping as dramatically, in terms of hours a day that they were.
Does the lower level has the lower level in the aquifer reduced at all the ability of the wells to pump?
No.
And
No.
how does this aquifer level compare to other droughts that we've had over the last 20 years?
Okay, here's the most updated groundwater levels at the USGS wells. The top one is the Chatham well, which is right at the intersection of Route 137 and 28. And so this starts January 1st of 2019 and goes as of this morning, if you will. And you can see this is the summer of 2020, and this is the summer of 2021. Here we are in summer of 2022. We are not quite as low as we were last year, but if you notice, the slope of the curve is indicating that more than likely we're going to get there. And then the bottom graph is the monitoring well in Brewster that most of the water districts around here use as kind of their bellwether, if you will. And you can see we had the drop in summer 2020, we had the drop in summer 2021, And so far this year, that well is actually lower than it was in 2020 or 2021.
So the
And again,
trend-
the slope of that curve
Yep.
is still trending downward.
Right.
And that's a result of the fact that, over the last couple of winters and springs, we haven't had snow melt and significant rainfall to recharge the aquifer, in the wintertime. So we're not seeing these high peaks in the winter months the last couple of years. Here we are the last 2 years, we're down by, a couple of feet compared to where we normally would start out, at the end of the winter, spring period.
But have we been this low or lower in the past? If you go back 20 years?
We had a drought back in 2016. I can look at the graph, I can pull the graph up and extend it back to 2016. I can't do that for the Chatham one because they actually changed the benchmark in 2018. But I think the Brewster one, well, maybe not because that's a replacement well as well. I'll see whether or not I can pull it up. I don't believe that in 2016 we were down at these lower levels. But I can certainly check and see if I can take a look
Well,
at
this
that.
could very well be climate change effects over time.
Well, do we
think
also,
that
do we
probably-
know for all of Cape, all the municipal services in the Cape, how much more water we're pumping now than we were 10 years ago?
Yeah.
With the increase. I mean, we're pumping a lot more water now.
Yeah, we're pumping a lot more water collectively across the Cape, there's no question. But as I've said before, USGS has estimated all the public water supply wells in the Cape are only pumping about 5% of the total aquifer. So, it's not like we're pumping 95%, oh my God, if we
Right.
pump more, we're gonna be in real big trouble. There's plenty of water under our feet. It's just been a question of getting it out and properly treating it, and I had this discussion with Water and Sewer this morning. It's more an infrastructure issue than it is necessarily a
Supply.
water volume issue.
How much, at these low levels, how far do our wells go below the level of the water?
It varies by well. We have some wells, such as wells 1, 2, and 3 in South Chatham, that are relatively shallow, meaning they're only 30 to 40 feet deep because they were put in back in the 40s when, water wasn't a big deal publicly, if you will. Most people had private wells. Our newer wells, for the most part, are over 100 feet deep. So depending.
And what's the level of?
Well,
the-
you have to take into account the ground elevation
Yeah.
and everything else, so it varies from at each well.
But even these 30 or 40-foot wells aren't in danger of sucking air.
They could be. And that's one of the reasons why we get very concerned when we start pumping 20, 21 hours a day. Because then you get that, and I apologize, I have a slide, but I won't bore you with it. You get that cone of influence where you basically suck all the water in and it gradually goes deeper and deeper the more you pump. And the closer and closer you get to that well screen where the pump is, that's what you worry about. And I'm sure you've heard Tom Temple say our wells have automatic alarms on them, that when they get to a certain point, they automatically shut off just to prevent them from sucking down too far and start sucking in air.
But that would be our vulnerability, not the amount of actual water.
Right.
It would be the
That would be, that's why I
limitation.
say it's more of an infrastructure issue than necessarily a volume of water issue.
Okay.
All right? Yeah. But we're in much better shape infrastructure-wise this year than, say, we were last year. We've got well 4 online. We've got 5 online now with the temporary PFAS. Knock on plastic, knock on real wood. We haven't had any wells go down because their pumps failed or bacterial contamination.
Right.
That's the thing you worry about, is those kinds of things that you can't foresee. PFAS we didn't foresee either, but now we've got 2 years of experience with it. But, you're always worried about, a pump failure or a motor failure that drives the pump, or bacterial contamination where you have to take a well offline, at July 4th weekend or Labor
Yeah.
Day weekend, when you need everything available. And luckily this year we haven't had that.
And are we prohibited by the state from drilling additional wells?
No, we
So
can,
if we wanted to resolve a lot of these problems, we could just either drive those wells deeper or put in some new wells.
there are limitations on how much water we can withdraw under the Water Management Act, but you can apply to the state to increase that volume.
Okay.
But the The last 5, 6, 7 years, the state's taken a very tighter look at that, especially on Cape. Just because we are a sole source aquifer, so, they want to make sure we don't overstress the aquifer. I don't think anybody thinks we're that close to it, but that's their job, is to protect it, make sure in the long term. But yeah, and that's one of the things the Water and Sewer Advisory Committee talked about this morning was at the request of the Board of Selectmen, they've been asked to put together a water management plan, if you will, and it will include looking at additional wells. We did that back in the 90s. That was what resulted in wells 10 and 11. There were several other sites that were identified. They all had kind of issues like high iron and manganese. So yeah, you could drill a well there, but if you put the well in, keep in mind, now you have to build a water treatment plant at that site. So that raises the cost from $5 or $6 million up to $10 to $15 million. So you don't do those things unless you need to. But I think we are going to be looking at some more wells. There's been talk of a third water tank, for more storage capacity in the summer months. So all those things are being talked about again,
I have a question. There's been a lot of discussion, as I'm sure you know, about the impact of the irrigation wells, private irrigation wells, on the aquifer and our town water supply. I was wondering if you could kind of connect the dots a bit on that. I get a lot of questions about this.
Sure. I suppose you'd listen to the Water and Sewer Advisory Committee, because that question came up as well. I was asked by a member of the Water and Sewer Advisory Committee what impact all the private irrigation wells, that we've been suggesting people do to get off public water supply. What impact was that having, say, on the aquifer? And my response to them is, or my response to that question is, quite frankly, I think the effect is relatively small. Because when you look at it on a volume basis, and I'm still trying to mentally figure out how I can do some calculations to show it mathematically, but if you look at a private well, that may work for a couple of hours a day, and maybe pumps a couple of hundred gallons or tens of gallons a minute, versus a public water supply well that pumps 1 million gallons, a minute kind of thing. Or not a minute, not 1 million gallons a minute, but 1 million gallons a day. The impact of those two is drastically different. In addition to that, most private wells are pulling from the surface aquifer, from the unconfined aquifer, because they're not very deep. Most of our town wells are deep and are below a confining layer, so they're actually pulling water from different areas in the aquifer. So those private wells, frankly, are more susceptible to the drought conditions, because they're going to be more impacted if that groundwater level continues to drop than the deeper public water supply wells. So overall, I think the scientific and realistic impact of private wells compared to the public supply is relatively small. Now, having said that, I also said, but I think it's incumbent upon private well owners to play along with the same restrictions and all that we put on people for the public water supply, because it is all still the same aquifer, and so even though their impact may be exceedingly small compared to the public side, they should still be playing by the same rules.
There was a proposal to put private wells on the same restrictions as Jim, which would mean if we do have a major snowfall and a very wet spring, but we have a lot of people here in the summer, and we have trouble maintaining the water pressure because of the huge flow out of the tanks used to all this summer activity.
Yep.
We would then be telling private well owners that they can't use their wells even though the aquifer is overflowing, which is ridiculous. And if private well owners could be instructed to use their wells appropriately, meaning in the evening when the humidity is 98% and there's virtually no evaporation, virtually all of that private well water goes right back into the groundwater. A little bit is taken up by the roots of the plants. The great bulk just goes down into the groundwater, and then it can be drawn up again. So telling people to build private wells, and then 2 years later saying, you can't use them and you're never going to be able to use them because every year we're going to have a water restriction in Chatham because we don't have the infrastructure, is silly. And, you know, there are just a lot of people in Chatham who believe that a green lawn is evil, that if they can't have a green lawn, then nobody should have one. And you read all these articles in the paper and you get all these emails that just suggest that you're some kind of ogre if you like a green lawn, which in New England and the Northeast, people have had for hundreds of years. And to now just say you can't do it isn't appropriate. So I would really argue strongly against saying every time there's a water restriction in Chatham because we can't pump enough and fill the tanks enough, even if the aquifer is full, we still shouldn't use private wells, and nobody should ever have a green lawn or a flower garden again.
Yeah, you've
It's
raised
silly.
absolutely valid points. Absolutely.
Is it true that the amount of water in the water tanks can get down to a critically low level? Where
Yeah.
the pressure would be questionable?
Yes.
It is.
When you get below 75 or 70 feet or so, yes, it could start to impact the pressure which is available for firefighting and.
Have we ever had that happen, Bob?
Yes, we have had the low level alarms go off, that, you know, it's all alarmed.
Uh-huh.
So there were a number of instances back in July and early August where the low level alarms were triggered.
Okay.
We haven't had one recently, which, you know, goes along with kind of the water conservation that people have been doing and, you know, less water being used. But yeah, that's a very real issue that, you know, if your tanks get too low, people in the outlying sections may lose water. And by that I mean that they don't have any because there isn't enough pressure to get it all the way to the farthest reaches of the system, if you will. Or if, God forbid, there were a major fire in town, you know, you wouldn't have the pressure to be able to properly firefight. So that's, yeah, that's always a concern. And, you know, it's more of a concern when your system is already kind of reaching max, meaning those pumps are already going 20 and 22, 23, 4 hours a day. Because then you don't, if the tank drops, even though the pumps are running, they're not filling the tank, they're providing water directly into the system.
Right.
You know, it's over the nighttime period when demand drops that you can refill those tanks. And so if you get in that circumstance where you don't have that kind of buffer, your tanks can get low, and if they get too low, then you could be in real trouble. And that's, you know,
And that
that's
just
something.
reemphasizes why we should not allow people to spray treated chlorinated water on their lawns.
Right.
Right.
And why it's a good idea to encourage people to dig shallow private wells if they really want to irrigate their property.
Right.
You know, the private wells aren't doing anything to cause the level in the tank to go down and create a pressure shortage.
What's a private well cost?
About $6,000.
Depends.
That's what they charge me.
Yeah, $5,000 or $6,000.
5 or 6?
You know, it depends on what kind of
Could be more than that.
material, you know, luckily most of the Cape is sand, so it's pretty easy drilling.
Yep.
But again, it really depends on how deep you have to go.
Okay.
But, okay, Bob, so has the Water and Sewer Commission been asked to get into this? We've had input about a water bylaw, which I take basically is regulating private wells, like the town with restrictions and so forth. Have they been asked to deal with this issue?
Yes.
We've had
As you
input
know,
about
we
that.
We already have in our general bylaw, chapter 261 is water supply conservation and emergencies. And that dictates what the response of the town is when, you know, we get into this kind of situation. So the Water and Sewer Advisory Committee has been asked to look into that from the private well perspective.
Okay, good.
You know, Ms. Freeman has provided a lot of information
Correct.
to both your board and the Water and Sewer Advisory Committee and the board, the select board on that particular topic. So they did discuss it this morning. They are taking all that under review.
And the Water and Sewer Advisory Committee has been has it been sort of dormant for a while and now it's back to life? Is that correct?
They have been dormant for a while because of COVID, and then they were dormant because they didn't have enough members on the committee to have a quorum. They are now back up to full strength.
Okay, so that's good.
And meeting on a regular basis.
And then two other things that just come up time after time, just briefly. Enforcement of the water restrictions is,
Yep.
how's that, what do we do? How's that working? People ask. And the other thing is, what's being done about getting the rest of the people irrigating their lawns with town water with a meter, on a meter? So those issues just keep coming up,
Yeah.
people ask.
Absolutely. I believe Pam said this morning there is actually 64 properties that are currently waiting for the second meter to be installed. So people are moving in that direction, but, you know, like everything else, they can't get a plumber right now to do the work, you know, internally. I think she said there's 64, 65 or something like that, waiting for that second meter to be installed to bring them into compliance. You know, enforcement has been difficult. Town of Chatham is small, our departments are small, DPW is currently short-staffed, they've been short-staffed all summer, and now we've asked them to go ahead, and now enforce the water ban and you know, the irrigation ban and everything else.
But that falls on the DPW?
It falls under DPW because the water division is under DPW. They have been working with Weston and Sampson, our contract operators. They actually have 2 people that are coming in 2 days a week at about 5 a.m. and driving around town.
Looking for wet roads.
Looking for irrigation systems and all that are going. And they have iPads now where they have information on all the properties and the people that have registered their irrigation systems and have the second meter and all that kind of stuff. So they're driving around trying to deal with that. Pam sent out, I think it was in the 90s, and I didn't bring the numbers with me, sorry. Actually, I did bring the numbers.
I'll move that right now.
From July 28th to September 8th, she sent out 180 violation letters to people. 60 some odd of those have been, or 6 have been second violations, meaning they're now, initially it's a warning, then a $100 fine, then a $300 fine. So 6 properties have been issued a $100 fine. And sorry, there's 160 second meters waiting to be installed. Not 64, 160 second meters waiting to be installed. So, you know, they are doing enforcement as they can and, you know, as the
So
situation
enforcement's
allows.
progressing.
Enforcement is progressing,
on it.
yes.
Okay, let's,
The idea of the second meter is they'll charge them so much that people won't use the water for irrigation?
Yes, there is a significantly higher
Unit cost.
rate
Yep.
per water being used strictly for irrigation.
all right, let's get to some public input, and then we can come back to more board discussion, but, because we have our deadline. So I'll just ask, is there anyone from the public who has a comment?
Gloria?
Thank you, Gloria Freeman again. I wrote to you about the regulation of private wells in water use restrictions. The issue that was raised was regulating private wells in a serious drought and whether the town could regulate private wells or not. And I hope that you have seen town council's opinion that Chatham can regulate private wells in its water use restrictions. If you haven't seen it, I can send it to you, or perhaps Judy would like to do that. I am asking that you put this issue on a future agenda as the regulatory agency for private wells. The Board of Health support for including private well systems and private wells will be meaningful and important, whether through a general bylaw modeled after the state's model bylaw or amending the town's water supply emergency bylaw. Thank you.
Okay, thank you. Yeah, we can put, thank you. We can put, what we'll just call water bylaw discussion as an agenda item in some future meeting, just to cover it more thoroughly.
Yeah, as I
think.
said, the Water and Sewer Advisory Committee is going to be working on something, so
Right.
rather than have 2 committees working on it at the same time, you may want to wait till they have something to, a straw man to send around for comment.
Okay, and we can wait for, yeah, that sounds, okay.
You guys can work on the rental bylaw, they can,
Yeah, and we're sending the rental bylaw to that committee. I
Yes.
think was,
yep.
okay, any, Chatham water quality, I mean, yeah, anything else on water? Okay, good. Number 6, COVID, and that's Bob as well, I guess. Hopefully there's good news here.
Yeah, well, there's news. I'm
Better.
not sure it's good news. But there is news, so just quickly here. I hate this one. Okay, weekly case count. Our weekly case count, it's down a little bit compared to where it was. It's not down to zero. We're averaging between 7 and 10 cases a week. Keep in mind, these are only the ones that are reported through the state system. So all of you that are at home and do an at-home antigen test, we never know about it. So more than likely, the actual case count is significantly higher. So that's kind of where we're at. I do about 11 weeks at a time here just to get a sense of what's going. We're a little bit lower than that spike that we had back in the beginning of July, so that's good news. But it's not going away. Our percent positivity, we're not back to where we were a couple of summers, last summer and summer of 2020, when we were down below that 5% threshold. We're still up in the 10 to 15, 20% range, and we've been fairly consistently there throughout the summer. I think that one big blip there, I don't believe that number, but that's what the state reported. So, it's definitely still out there in the community. We're above the 5% threshold that is considered community transmission. CDC has lowered Barnstable County to the low category for community-wide, taking into account everything. So, it's not getting any worse, but it's not necessarily getting better either.
So Bob, but the percent positivity is of those taking the PCR test?
Yes.
So it doesn't,
Doesn't
no input from the
include
home
the
test,
antigen
which
test or anything like that, right?
is
It's just,
probably
again,
a
it's just the
much
data.
bigger group. So
Yeah.
it may, the
Yep.
meaning of that might be not what it was
Yeah,
before.
I mean, it gives you a trend of what's going on in the
Yeah.
community, but it's, don't worry about absolute numbers.
But those PCR tests are being done for a reason.
Right.
This is not a background statistically significant reflection of what's going on in the community, other than individual suspect cases are being tested.
Yeah.
Bob, do you know what the incident rate is this week? Because I think that's a more telling number.
I didn't bring the incident
I was
rate.
gonna try and look it up quick.
Yeah, I actually have it graphed, but
Hospitalizations
well, actually,
And then just briefly, the new authorized,
yeah, I was gonna
Booster?
touch base with that in a second. Let me just see if I have the average daily incident rate. No, that's an old one, I think.
I think I can have it quick.
Well, I can't find it right at the moment, but anyway. And then the final thing that I just wanted to show you real quick was the hospitalizations, because I know that's always a topic of interest. Hospitalizations at Cape Cod and Falmouth, they've been pretty consistent over the course of this goes back to the beginning of July. So basically over the last 2 months, we've been averaging, a low of say 10 cases and a high of about 18 cases. Last one in Cape Cod Hospital, which is as of last Thursday, was 18 cases in there and 7 in Falmouth.
and does the hospital, Cape Cod Hospital, differentiate those admitted because of COVID and those who have COVID on the testing at admission?
They do, that's not shown here. This is just total number of cases.
Total number of cases?
Yeah, that's because it gets
So
too busy.
who
if I
are
start.
these cases?
Huh?
Who are these cases?
The cases have been across the board in pretty much all age groups.
Okay. Are they vaccinated?
About 50%,
Okay.
between 50 and
So both-
60%
still
of the
half and
cases
half.
are in people that are, quote, fully vaccinated.
Huh.
We're still dealing with the Omicron variants that, are more contagious. They're not necessarily more severe in terms of causing disease, but they are more contagious. And so we've seen a lot of people that, have had it before or are fully vaccinated still testing positive. You may not even know it, or you may have very mild, sniffles or whatever, My wife had sniffles one day. We didn't really think anything of it, and 3 days later, before we were traveling, she tested positive. So, that's, and a lot of people mistake it for allergies or, seasonal cold or whatever, so. And then just two other things, just quickly, thanks to Judy's help, we are getting about another 3,000 home antigen tests. Out of that, when the state announced it about a week ago that they were gonna make a couple of million available, we're able to get close to, 3,060 or something like that. So we talked about how many we should get. I said, get them all. So we're gonna get them. We're gonna continue to distribute them upstairs. We'll make them available to the Council on Aging.
How's that going? I mean, do we have a steady?
It's still steady.
Good.
Yes, people are still looking for them. As you probably know, the federal government discontinued their program as of not last Friday, but the Friday before that was the
Yep.
last day to order them from the federal government until Congress passes some more money, but we will have them available here for folks.
Nice.
And then the other thing that I just wanted to update you on, I know this was sent around to everybody, but just for the folks listening at home, Barnstable County has scheduled 3 upcoming clinics where you will be able to get the new bivalent vaccine, so the original strain plus the new Omicron strains, as well as flu shots. So you'll be able to get both of those at the same time, if you will.
Perfect.
And they are coming up on September 21st, September 30th, and October 5th, and it's by appointment only. So unlike previous times when people could just walk in and get a shot, just to kind of keep the crowds and all under control, they're only taking appointments, but you can go to the Barnstable County website, which has a link to the scheduler for requesting an appointment. So I urge everyone to do that, especially, right now, the Pfizer bivalent is available for anyone 12 and older, and the Moderna bivalent is eligible for anyone 18 and older. So, we're getting into the fall season here. We saw in the southern hemisphere that flu was very prevalent this year after being pretty much non-existent for 2 years because people were social distancing and wearing masks. So there's a real concern that this flu season could be really tough. So the urge is for folks to get their flu vaccine and get the new bivalent vaccine for the COVID as well.
And CVS in Chatham now has the new vaccine. You can get it in one day.
Yep.
So you don't have to go all the way to Barnstable.
Yeah.
You can get it for free
It is pretty
at
much
CVS.
available in many, many places now.
Is there any
Okay.
consideration about whether it's a good or a bad idea to get both vaccines on the same day?
All the data that I've seen and all the recommendations that I've seen from the CDC and the state and FDA and all
No
is go ahead
problem.
and get both vaccines together. You can
Now,
get them both the same day,
none-
same time.
None of these injections have both entities in them. So if we go to the Barnstable County, you're gonna get 2 injections.
Right,
If you want them both.
right. You're
If
gonna
you
get the
want
flu
them both, But there's
vaccine.
no vaccine that's a combo
Right,
vaccine.
there's no combo flu COVID vaccine yet.
Not yet.
So,
Okay.
no, it would be 2 separate shots.
Just so you know, I am organizing the town annual flu clinic.
Right.
It's scheduled for October 19th. The location is kind of up in the air. We were planning on having it at the DPW, but they may be doing some paving over there. So I may have to change the location. So more information will be forthcoming on that. So, and I'll
Okay.
also be doing another clinic for town employees in school, October 19th. But I'll be getting that information out, and that's gonna be a registration on, you have to call in to Cape Cod Healthcare to register for that, which should be fairly
Okay.
simple.
Is
But
there
if
any,
you don't want to wait until October to get that flu vaccine,
You
the
don't.
county has it available and CVS and other places has it
I mean,
available.
there is an argument that you don't want to get that vaccine too early.
No, but you want to plan because it takes about 2 weeks to get up to full, kind of protection. So
Yep.
thinking ahead of what you may have planned,
Right.
you can kind of use that to decide when the appropriate time is to get it.
And the period of time between your last booster and this new Omicron booster?
2 months.
2 months.
At least 2 months.
Gotcha.
After your last booster shot.
All right.
Wait 2 months and then go ahead and get the new
and
bivalent.
after prior infection? You have to wait?
Prior infection, again, you can wait a couple of weeks, but you don't have to wait 2 months.
Okay. All right, other questions? If we don't, any public comment on COVID update?
No?
Okay, then our last item is the minutes from August 15th. Does anybody have any comment, addition, correction? And if not, can we get a motion to approve?
I'll move that we approve the draft minutes for August 15th.
And a second?
Second.
Okay, so we'll take a voice vote on approving the minutes of August 15th. All in favor, say aye.
Aye.
All opposed, say no. Okay, the minutes pass. And then if there is any other, no other new business or something to mention, we'll go ahead and close the meeting.
I'll make a motion, we adjourn.
Okay, second. Ron, second. So we'll take a voice vote on adjourning the meeting. All in favor of adjourning, say aye.
Aye.
Opposed? Okay, we're adjourned. And we're off the...